This taping technique is a nice taping technique for ulnar-sided wrist pain, maybe distal radial ulnar joint laxity, or maybe TFCC injuries here, or even a little triquetral pain or ECU tendonitis on the ulnar side of the wrist. So what you're going to do is you're going to create a U horseshoe shape that's going to go along the ulnar styloid. And so what you'll do is you'll do 2 4-centimeter anchor, do a 1 centimeter horseshoe cutout along either border here. This is where you'll be your starting point at this point. You'll break those straps. Lay that just inferior to the ECU tendon. No tension on those anchors. Then what I'll go ahead and do is about 50% support based on what you're trying to achieve. Wrap that around one piece. 50% support distally. You want to make sure not to get it too tight. All we're looking for is some distal radial ulnar joint support. That's the first portion of that. If that stabilizes the ECU tendon or decreases pain, you're good. If you want to add a second piece to that to give a little more ulnar joint stability, then what you can go ahead is do an eye strip. Probably an 8 to 10 centimeter eye strip. You'll bring it over top of this and lock that wrist in. I give about 50% tension with this here and wrap that right around and lock in on the other side. This is great for weightlifters, gymnasts, anyone that requires baseball, any kind of sports, swinging sports, those types of things. It's just general wrist stability.